what is your recommendation, Dr. McGrath, for parents and guardians regarding children returning to school?
We talked about it in our Pediatric Infectious Disease Society. There was a webinar where multiple experts from around the country discussed the sort of broad recommendations. And to take away from that, if the percent positivity of the testing in a local community is more than 5%, that group suggested that it would be suboptimal probably to go back in face-to-face classrooms. Now, that group absolutely, and myself included, believes that in-person schooling is the best for children. And especially for me, I have a child with special needs in learning with dyslexia and dysgraphia. So for him, we are more worried than for my daughter who doesn't have those same issues. For him in the digital learning sessions, he really doesn't do very well. He really needs sort of like carved out specialty type of things. Now, if the percent positivity in the local community is 5% or less, there was still recommendations about if the school chooses to offer face-to-face, that the class sizes be reduced at some capacity to be able to have the children in their desks socially distanced, minimally 3 feet, but optimally 6 feet apart from each other, with a plan in place suggestive of environmental services, being able to clean the rooms, either if you, because some schools were talking about having an A session in the morning and then like a B session in the afternoon, and using the same classroom in the teacher. But the problem is that you have to clearly define how would you clean the classroom in between and things of that nature. Another concept about going back to face-to-face is cohorting, which is the same idea that that group of kids in the A session is always with the same teacher, and they always stay in that room while they're at school until they go home. And in that case, when they go home, the idea is that they would either be, wearing masks or things of that nature, but the masking was a little bit difficult to mandate in the sense that if the schools don't have additional funding, I'm concerned that for most of the school districts, the percent of positive tests is well above 5%, but I just plead for them to consider those special needs children. The digital schooling might work for a lot of children. Some of the kids with special needs need a little extra support with this.
Would you send your kids back in person right now?
If you want my opinion, if those criteria that I kind of listed, if the 5% positivity could be, or less could be there, and those other things could be in place, I think I probably would send them, because like I said, for Gavin, I definitely would. For my daughter, she's fine either way. She, for the social aspects of school, I think would prefer to go to school. But right now we are hearing from our own district that I don't think there's going to be in-person offered at this time. So it was something we, my wife and I had highly considered, but it looks like that's not going to be an option for us right now anyway.
I have two young ones. They're not in school yet, but they are in a daycare. That's been a big challenge due to the daycare being closed. But I think following along with what Dr. McGrath said, the having if the rates are lower, and on top of that, the school is trying to do the best that they can in terms of making things clean and having a process in place, I think I would feel comfortable. I think one of the big issues that's kind of happening across the country, which is a challenge, is that, and this is even related to other things as well, like do we play college football or something like that, is that people want to open or they want to close. There's a lot of unknowns. And the unfortunate thing is, because of the unknowns of how to deal with it, is that there's really no plan in place that what happens if your school does end up having 20, 30, 40 kids that are positive? How do we deal with that? And I guess the fear is nobody really knows the right way to do it. I think that would also help out in certain districts, that if they had a plan in place to be proactive. And unfortunately, I'm just not hearing that. And I think, unfortunately, a lot of the chatter is out there. I think the rates are low enough. I would probably feel comfortable, but I can understand the argument the other way of where schools may not want to open as well, due to the safety and the fear of what could possibly happen.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.